Welcome, everyone, to a journey into the intricate world of cardiac health. Today we're focusing on a relatively rare, yet significant, heart condition called papillary fibroelastoma, or PFE for short. Join us as we unravel the mysteries of this often overlooked cardiac tumor. The exact cause of papillary fibroelastoma remains somewhat elusive. It's generally considered to be a benign tumor, not a malignant one, but its origins are still debated. Some researchers believe it may arise from organized thrombi, meaning blood clots that have essentially become organized and transformed over time. Others suggest a hamartomatous origin, meaning it's a benign growth arising from a disorganized mixture of cells normally found at that site. Endothelial damage, possibly from previous infections or trauma, might also play a role in its development. Let's delve into the pathophysiology. Papillary fibroelastomas are typically solitary, pedunculated tumors, meaning they have a stem or stalk attaching them to the heart valve or other cardiac structure. They are most commonly found on the heart valves, especially the aortic and mitral valves, although they can appear in other locations as well. They are composed of avascular fronds of collagen, elastic fibers, and mucopolysaccharides. The primary concern with PFE lies in the potential for embolization. This means that fragments of the tumor can break off and travel through the bloodstream. These emboli can then block blood vessels in other parts of the body, potentially leading to stroke, transient ischemic attack, myocardial infarction, or peripheral arterial occlusion, depending on where the embolus lodges. Epidemiologically, papillary fibroelastoma is considered a rare tumor. Autopsy studies have shown an incidence rate of approximately 0.17% to 0.3. It can occur at any age. It is most commonly diagnosed in adults with a mean age of diagnosis typically between 50 and 60 years. There is no known significant gender predisposition or racial predilection. Now let's talk about the signs and symptoms. In many cases, papillary fibroelastomas are asymptomatic, meaning they cause no noticeable symptoms. They are often discovered incidentally during routine cardiac imaging performed for other reasons. However, when symptoms do occur, they are typically related to embolization. These symptoms can vary widely depending on the location of the embolic event. Neurological symptoms, such as transient ischemic attacks or stroke, are common. Chest pain, shortness of breath, or other symptoms related to myocardial infarction can also occur. Less commonly, peripheral embolization can cause pain, numbness, or coldness in the affected limb. The diagnosis of papillary fibroelastoma usually involves cardiac imaging techniques. Transthoracic echocardiography, or TTE, is often the initial diagnostic tool. It's a non-invasive ultrasound of the heart that can often visualize the tumor. Transesophageal echocardiography, or TE, provides a more detailed view and is frequently used to confirm the diagnosis and assess the tumor's characteristics. Cardiac MRI and CT scans can also be helpful in certain cases, particularly for visualizing tumors in less accessible locations. While not strictly classified into subtypes, papillary fibroelastomas can be described based on their location within the heart, such as aortic valve PFE, mitral valve PFE, or PF located on the tricuspid or pulmonic valves. Their size and morphology, such as the presence of multiple fronds or a single mass, can also be noted in their description. The treatment and management of papillary fibroelastoma depend on the patient's symptoms, the size and location of the tumor, and the overall risk of embolization. Asymptomatic patients with small tumors may be managed conservatively with regular monitoring via echocardiography. Antiplatelet therapy, such as aspirin, may be considered to reduce the risk of embolization. Surgical excision, meaning surgical removal of the tumor, is generally recommended for symptomatic patients or those with larger tumors deemed to be at high risk for embolization. This is often performed using minimally invasive techniques. Anticoagulation may be considered in specific cases. Unfortunately, there are no known specific preventive measures for papillary fibroelastoma, given the uncertainty surrounding its etiology. Maintaining overall cardiovascular health through a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, is always beneficial, but it's unlikely to directly prevent the development of PFE. The prognosis for patients with papillary fibroelastoma is generally good, especially when the tumor is detected early and treated appropriately. Surgical excision is typically curative, and recurrence rates are low. However, the risk of embolic events prior to diagnosis or treatment remains a significant concern. Ongoing research focuses on understanding the etiology of PFE, refining diagnostic imaging techniques, and developing strategies to minimize the risk of embolization. Recent advancements in minimally invasive surgical techniques have also improved outcomes for patients undergoing surgical excision of these tumors. As research continues, we hope to gain a deeper understanding of this fascinating, albeit rare, cardiac condition.